Hello friends, welcome to my channel Healthy 5 with Dr. Niyati. I like to bring different topics of Ayurveda so that they become easier for you to understand. In the recent years, Panchakarma has come heavily into the limelight. Everyone's talking about Panchakarma, and so many people are also asking me this question, Ki madam, what is exactly Panchakarma? Can you explain it to us? So I'm coming with 3 videos, out of which today's is the first video about what exactly is this Panchakarma. Now we know that according to Ayurveda there are 3 doshas, Vata, Pitta and Kapha. They're called as doshas because they cause certain inabilities or disabilities in the body. The things that disable us are called as doshas in short, or they cause diseases. Now these doshas, if they are in a small quantity, the doctor can give medicines and they can be suppressed, or they can be digested and removed out of the body. But many a times these doshas increase to such an extent that one has to remove them out of the body. Means these doshas have to be removed from the body. And the process by which these doshas are removed from the body is called as Panchakarma. Now, from the name you'll understand Panchakarma, 5 karmas. But I always equate Panchakarma to surgeries. When you go for a surgery, the doctor prepares you for the surgery, and that is called as pre-operative, then you're operated, and then there is the post-operative care. In the same way for Panchakarma, you have to do a pre-operative process, then you do a Panchakarma, and then you do the post-operative process. So these processes are very, very important. Now who decides? So the Vaidya or your doctor, Ayurvedic doctor decides which karma you have to be given and which Purva karma. Now among these 5 Panchakarmas, for some karmas you have to do internal Purva karmas. For some karmas you have to do external Purva karmas. So the Vaidyas, the doctors know about it, which karma, for which karma, which Purva karma has to be done, and they will do accordingly in your best interests. So now coming back to the 5 karmas. Which are the 5 karmas? The 5 karmas are Vaman, that means controlled vomiting or emesis. Then is Virechan, means giving you medicines by which you take the medicines and then you have some amount of loose motions. The third is we can equate it to enemas, though these enemas are out of kadhas, oils and many other medicines. The 4th karma is the Nasya karma, means putting medicines through your nose. And the 5th karma is also called as Rakta Mokshan, means bloodletting. So bloodletting can be done by the use of leeches or by just syringe, putting a needle like we do for blood donation. You can let out blood, or you can just, in the olden times they would put a horn and they would express the blood, make a small injury there and remove the blood. So there are many ways in which you can remove blood from the body. But why is Purva Karma done? So I'll give you an example of like skin diseases. In skin diseases, the main Panchakarma is emesis or Vaman. So if the doshas, the 3 doshas out of which the Kapha dosha has to be removed, it is in my skin. So how can I remove it from my stomach? That means I have to bring that Kapha into my stomach and then I have to remove it. So the karma by which this Kapha, which is in different parts of the body, is brought into my stomach and then removed is called as Purva Karma. It could be Vat, Pitta, Kapha. Now I'm told the example of the skin. The doshas could be anywhere and they have to be brought into the alimentary canal to be removed by Vaman or Virechan or Basti. So this is called as the Purva Karma in order to prepare the patient. Now in Panchakarma, once the Panchakarma is done, then is the post-operative process. So you can imagine that if a person has taken a medicine to emit or to vomit, then the vomiting, it takes at least 4 or 5 large vomit the person does. So you can imagine that the person gets very exhausted. So the digestion capacity of the person also reduces. In general, the energy also reduces. Hence, the post-operative process is extremely important. One must pay good heed and listen to what the Vaidya is telling you about what you need to eat after the Panchakarma. So you have to slowly you have to start increasing the amount of food that you eat, so that there is not much pressure on the liver and the whole digestive system. So now you must have understood that Panchakarma is generally, like I said, it's done for diseases. But Panchakarma can be done for a healthy person also. The main motive of all Ayurvedic medicine is to keep a healthy person healthy. So in order that a healthy person remains healthy, that person can also undergo Panchakarma according to the seasons and according to the advice of your Vaidya or your doctor. So what are these Purva Karmas? How do we go about these Panchakarmas? What are we going to go through? You'll understand in the next two chapters of or the next two episodes of Panchakarma. So do not forget to view them. Write your comments. Even if you have any questions or doubts, you could drop them in the comment box and I can answer them. Or if you need me to make any other episodes, you can also let me know. Don't forget to like my videos. Your likes and your comments give me impetus for making different and new videos for you. Also, if you haven't subscribed for this channel, do so, and don't forget to press the notification bell icon. Thank you.